Hello, my name is Dr. Justin McCormick. For the last 5 years, I've been specializing in the diagnosis and the treatment of herniated, slipped, and bulging discs. The treatment we do here is a highly specialized technology called spinal decompression, or more specifically, the DRX9000. First, let's talk for a few moments about how does this occur? How does a disc problem actually happen? It will happen through either a micro trauma, or B, a macro trauma. Now, most people think that to get a disc to herniate, they have to have some serious injury, like a motor vehicle accident, a work injury, some significant slip or fall. The reality is, when I interview most people for this program, it's not a serious injury that causes this. They don't really know. It just progressed gradually over time. Whether that be from bad posture, doing some repetitive thing over and over again, and over years, it slowly breaks up the disc tissue into what we call a desiccated disc. Now, a desiccated disc is basically a disc that's dried out. In the beginning, the patient may or may not know they even have a problem, or maybe they'll have some slight stiffness occasionally. But as that dried out disc starts to spread, it will become what we call a bulging disc. So if you'll look at these right here, this right here is a typical disc. You can see the disc height there. From the inside, we can see that fluid in there. All those nerves are working good. The spinal cord in the back is working good. But the difference between this and a bulging disc, you could see from the inside that fluid starts to push outwards. And what that does is it pushes onto the nerve and may cause that person some pain. It will also, as we talked about, dry up the disc, and you can see how this disc is quite a bit smaller than this one, about half the height. Now, if that person still does not catch a bulging disc in time, it will tear. And that's what we call a protruded or even an extruded disc. The difference being how far out that fluid pushes. So what happens is that outer ring tears, that fluid starts to leak out, and it will hit a nerve. Once it hits that nerve, not only is the pain going to become sharp and stabbing in most cases, it will also travel down the arm or the leg and become tingling, numb, weak, sometimes shooting or shocking pain. So again, this is a protruding or an extruding disc contacting that nerve. If that problem continues to progress, it will do what we call sequester. And that's where that fluid piece that we see right here actually breaks off and floats into that spinal cord or spinal nerve area, which is that is only a problem for surgery. That's basically the only thing that that person can do, or live with the problem. So that's some of the disc problems that we see here. Now, what should a person do? The problem that I find with most people with back problems is the only thing they do is take drugs. And if they want something even more aggressive, they'll take corticosteroids, where they inject that person's spinal cord or nerve or disc with a steroid that is designed to relieve the pain. The only thing that that does is covers the pain and actually allows, in most cases, the problem to get worse. It would be a similar analogy to a dentist who sees this terrible cavity, and he takes the patient and he just injects him with Novocaine and says, "Go ahead and just come back, Mrs. Jones, when it hurts again." We would all know that that's doing nothing for the problem and just allowing it to get worse. So again, what should you do? If you catch the problem early, when it's desiccated, maybe bulging, stretches, exercises, chiropractic care, and physical therapy are very good things to start with. And many times they can relieve that person's pain and get them healthy again. If you are not responsive to that, maybe it's gotten worse, or you're just not getting any help from that type of treatment, then spinal decompression may be the right option for you. What spinal decompression does is it targets the bad disc, and then it pumps it through several computers that we have in the DRX9000. Now, it's important to know the difference between traction and decompression. The DRX9000 is not traction. What traction does is it pulls on the patient's spine, and what that does is potentially cause that person's problem to go into a spasm, because there's no feedback loop between the treatment and the patient. Okay, there's nothing that the treatment knows that the patient's doing. So if all of a sudden that person's back starts to tighten up under treatment, it's still pulling. So it can actually make that person's problem worse. What DRX9000 does is it has a feedback loop. And DRX9000, what we use here, is the only true spinal decompression. What happens is, when we program the person's problem into the treatment, into the technology, it starts pumping that person's disc. And as that happens, it pulls water, oxygen, and nutrients back into that disc tissue. It will pull that fluid off that person's nerve, and in time, that fluid will start to go back inside of the cavity, taking away that intense nerve pain that's causing all that person's problems. So DRX9000 is the only treatment that has that feedback loop, like I was saying, where it can read exactly what that patient's doing. And 16 times every second, it's going in and out of the patient. So this patient's laying here, all of a sudden their muscle starts to tighten up. The DRX9000 knows that, and it backs off, allows that person's body to relax, and all of a sudden that person can, get back into that normal resting state. The decompression knows that, and it starts to pump it again, allowing that person's body to heal properly. Now, if you want to know if you are a candidate for the DRX9000, call the number on the screen. Okay, it's 425-379-6004. Our office is staffed 24 hours a day, 7 days a week, although we still are very busy, so if you do call and nobody answers right away, one of our 3 staff people, or we have other people that will answer as well, leave a message. We'll get back to you within 24 hours. Okay? In addition, we do have a special opportunity that may be for you. What we have is, for the next, certain amount of people, if you'll go below on the video that you're watching right now, there's an intake form. Fill that out and it will tell you how many opportunities, how many spots we have for not only a free consultation with me, but also a free exam. We'll do 40 or 50 tests, find out if you're a good candidate. But if you are a good candidate, you're going to get your first treatment covered. Your first treatment on DRX9000 is going to be completely covered. It's going to be on us, okay? Again, that's only if it's still available, and that's only if you actually are a good candidate for this procedure. So call as soon as you can. Make sure that you get one of those remaining spots that's available. I really do look forward to helping you as soon as possible, and it's going to be great to meet you guys. People get their lives back here every day, and I really look forward to meeting you. Thank you.